Can you tell us first what is entailed in a good comprehensive examination of the duodenum?
Well, first of all, the endoscopists have to do a good job in paying attention to everything. But obviously, there are some corners and blind spots that are hard to reach, and such as the D1, D2 location and the periampullary area. So we need to be able to see them well. If necessary, we can put a cap at the tip of the endoscope or use a duodenoscope to look at these areas better.
Terrific. There's been a lot of literature recently about a variety of techniques to manage duodenal adenomas, including cold snare EMR, traditional hot snare EMR, and even underwater EMR. Can you enlighten us about what the best approach is for these lesions in 2024? And what are some of the risks that people might be worried about in managing these lesions?
Well, first of all, we need to know that most of these lesions are flat or have some flat components. So lifting and removal is very, very important. And perforation and bleeding are risks that we need to be careful with. The hot snare that seemed to be the best method up to today, but the cold snare is gaining traction and actually maybe even safer than hot snare in preventing perforation and bleeding. The underwater EMR has been reported to be quite safe from the Japanese literature, up to 2 centimeter lesions, but they are limited experience. I think that we need to refine the technique before we can popularize it. So cold snare is the best today.
And in terms of the risks that may be associated with these lesions and their resection, what are they and how do you mitigate that?
The bleeding and perforation are common because of the thin wall and higher vascularity in this area. So we need to be careful. Careful examination during and post-procedure is very important. And closure is very important. Now, we have to be careful using closure technique with clips. The very technique they try to close, the clip itself may get too deep into the thin wall musculature and actually cause perforation. So we have to be careful. And watching the patient overnight, maybe 1 or 2 days, is very important for the lesion that are 3 centimeter or larger because there's a 25% chance of bleeding. And most of these lesions probably best treated by the experienced people when they're larger. They have the skill set that is needed to take care of these patients.
Terrific. Well, we'll invite our readers to read all the details in the upcoming issue of Gastroenterology. Thank you.